Narcan is credited with saving hundreds of lives every day by reversing overdoses. But the skyrocketing cost of the drug is hitting taxpayers and consumers in the wallet. It's even causing concern for first responders and members of Congress. Investigative reporter Paul Van Osdol has the story.
Hit it with the Narcan.
Is bringing people back to life.
Take a deep breath.
Without Narcan, you'd be dead?
100%, absolutely.
With the opioid crisis sweeping the country, demand for naloxone has soared, and so has the price.
If you are ready to use, pull off red safety guard.
Evzio is the only FDA-approved auto-injector version of naloxone. In 2014, it hit the market with a price of $575 for a 2-pack of injectors. In 2016, drug maker Kaleo hiked the price to $3,750. That prompted U.S. Senator Claire McCaskill of Missouri to launch an investigation.
We got to really look at what is a pharmaceutical company doing, making the price unreachable for the very drug that can save lives.
Westmoreland County, Pennsylvania got state grant money to supply police officers with Evzio. But when the money ran out, the county could not afford to pay full price.
It's ridiculous. I think it's taking advantage of a sad situation. They should be giving this stuff away as far as I'm concerned, you know.
In a statement, a Kaleo spokesman says, our first priority remains ensuring that patients can access Evzio. It says the drug is free for patients with no insurance and incomes under $100,000. But now Kaleo faces a lawsuit by a pharmacy benefit manager. Express Scripts says Kaleo raised the price of Evzio excessively to exploit for profit those who depend on it. The lawsuit also accuses Kaleo of failing to pay millions in rebates, which would help keep the price lower. Kaleo countersued, saying those rebates only help Express Scripts to drive up its own profits, and that the company made it hard for patients to access Evzio.
Both of the sides are wrong and they're right, and that's what makes it so complicated.
Dr. Waleed Jalad studies drug pricing at the University of Pittsburgh. He says as long as demand for naloxone is high, drug companies have no incentive to cut the price. And pharmacy benefit managers are adding to the cost by charging drug makers to qualify for insurance plans.
The bottom line is both are at fault, and the system is completely out of control.
Paying the price? Police, fire, and EMS agencies around the country, and ultimately, taxpayers. And it's not just Evzio. We crunched the numbers for all forms of naloxone in 6 locations around the country and found the cost skyrocketing. In just 1 year, the cost of naloxone jumped 52% in Louisville, 83% in Baltimore, 116% in New Orleans, 312% in Pittsburgh, and 528% in Delray Beach, Florida. Allegheny County, Pennsylvania paid just $10,000 for naloxone in 2015. A year later, the cost ballooned to $144,000. Matt Brown is the county chief of emergency services. How much of a concern is it to see that cost going up?
It's a huge concern. How do you budget for that?
There are some signs of encouragement. More companies are now making naloxone. You've probably heard of Narcan, the best known and only version approved by the FDA for nasal use. It's made by Adapt Pharma. The wholesale price of Narcan is $125 for 2 doses, but Adapt is selling Narcan to public agencies for just $75. When you have a product that literally can save someone's life, how do you decide what is a fair price?
Well, I think there's a lot into our pricing policy. We are the least cost per milligram for a ready-to-use product than anyone out there. So we came in at the lowest price possible.
He's so silly.
Bree Swarmer says she cannot put a price on her life or her daughter's.
Look at my daughter. You know, she wouldn't be here if not for 23 hits of Narcan.
Bree says she overdosed nearly 24 times before getting clean 2 years ago.
They know people need it. They know they're going to make money off of it. And they're making billions and billions of dollars off of people suffering.
Senator McCaskill is asking naloxone manufacturers to provide details about why costs have gone up so much. She also wants information about any discounts or rebates the drug companies are offering law enforcement and community groups. I'm Paul Van Osdol. Now back to you.
And WJCL's parent company, Hearst Television, is part of an ongoing initiative to try to put a stop to the opioid crisis. If you'd like to learn more, you can just visit the State of Addiction section on our website, jcl.com. Well, next at 11:30, a gunman opens fire during Sunday service at a Nashville church.